I carry the gene. That's what sensitivity testing will show you. I carry the gene for gluten sensitivity, so my son Jake, guess what? Yeah, he's gluten sensitive. And I'll tell you, there's a place here in Appleton called the Free Market, and I don't know the owner, but I've heard she has celiac disease. They have a whole section of gluten-free products. You can do this, folks, if you're not already. But you want to test for it first. You don't know unless you test. So what I have patients do is tell them, keep eating a regular diet, what you've been eating, until after the testing. This is a stool sample. Here are some of the symptoms of sensitivities: chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers, and they vomit often. I don't see many that vomit often. I haven't seen any. But I've had a few with mouth ulcers, and it's measured in units, 0 to 10 being normal. And frankly, if they're 9 or 10 units, I consider them abnormal. But 0 to 10 units, and that's within the normal limits. This patient was 400 units who had the mouth ulcers. So the only way to find out if your child has these sensitivities is to test for them. Okay? And if parents bring their kids in and they're already off gluten, I want them back on gluten a week before the testing, and then they can get back off of gluten. We've got to see what's going on. You want to run complete blood panels, a thyroid panel, complete metabolic panel, lipid panel, CBC, complete blood chemistry with autodifferential, and you're going to see why here in a minute. We can assess your child's thyroid, adrenal glands, liver, kidneys, red and white blood cells, gut function. These can all be affected with autistic disorders. If your child is older than 12, we will probably run an adrenal stress index. The adrenal glands sit right above the kidneys. They're your stress glands. This is a salivary test. And especially if the patient suffers from insomnia or diabetes. Immune panels. These are extremely important. Many, I'm not going to say all, but I'll say very close to all. Autistic patients that I've treated and that I've helped other doctors treat suffer from an autoimmune condition. This is why the immune panels are so important. I would say 99.9% of the autistic kids that I've checked in my practice and from doctors across the country, and you can see these doctors at lifechangingcare.com. I'm not handing you a bill of goods here. I'm telling you, I've helped thousands of autistic cases. I consult with over 1,000 doctors across the country. They are listed on lifechangingcare.com. And actually, if you go to the section with the ADD, ADHD, Dr. Andy Barlow has some testimonials up there. So we want to check the immune panels. There's two parts to your immune system, Th1 and Th2. They need to be integrated. They need to be working in conjunction with one another. So how do you know if one is dominant? How do you know if Th1 is dominant or Th2 is dominant? You run the test. What do you run? For Th1, you run interleukin-2 and TNF-alpha. So interleukin-2 and TNF-alpha, this is a blood test. If these levels are high, these markers are high, they're Th1 dominant. Th1 is T cells. T cells are the army that attacks and cleans up afterwards. Helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Th2, the markers are interleukin-4 and interleukin-10. If interleukin-4 and or interleukin-10 are high, your child is Th2 dominant. Th2 is B cells. B cells make antibodies. They tell T cells what to kill. If the testing comes back with a high B cell count, the patient is Th2 dominant. So, you run these panels, T and B lymphocyte and natural killer cell panels. Interleukin-2, TNF-alpha, interleukin-4, and interleukin-10. Natural killer cell activity. So once you determine if it's Th1 or Th2 dominant, you want to determine what's causing it. Is it an active antigen, something that the body needs to kill? Or is it dysregulation? Is it a problem with anemia or blood glucose or gut function or something along those lines? Have you heard this before? I doubt it. This is why I teach doctors all over the country. This is what's going to help your child. So, what is an active antigen? Parasite, bacteria, virus, mold, yeast, fungi, protozoan, foods. That's why we run the sensitivity testing, folks. Chemicals and heavy metals. The best indicator for an active antigen is with the blood tests, and you're looking at the T and B cell panel. It's the T cell helper suppressor ratio. It's also called the CD4-CD8 ratio. Now, the closer to 2.5 that, with the ratio, or above 2.5, it's most likely you're dealing with an antigen. So you want to eliminate that antigen. If the ratio is below 1.2, then you're most likely dealing with a dysregulation problem. Like I mentioned, anemia, blood glucose, gut function, etc. So you want to look at intestinal permeability. Your child may have leaky gut syndrome, very common with autism. Now, leaky gut syndrome, for those of you who don't know, is a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet. Diet is extremely important. If your child is a junk food junkie, if you're feeding your child junk food, and the reason they call it junk food is because it's junk, you need to get serious and change their diet. Parasites or infection. All this can lead to increased permeability of the gut wall to toxins, microbe, undigested food, waste, or larger than normal macromolecules. It's been proposed that these substances affect the body directly, while others postulate, including myself, an immune reaction to these substances. If your child is a bit older, we may run hormone panels. So how do I successfully treat and address your child's positive metabolic findings? By using specific nutritional protocols, like the autoimmune protocol, and something called glutathione. There's the information in this packet if you've requested this information already on glutathione. If you're watching this on the website, then just fill out the 2 free visit and we can send this information to you. Glutathione is the mother lode of antioxidants. Very important in helping your child. So that's the metabolic side, the right hand. Now let's talk about the left hand. What's the left hand? Specific neurological testing and treatments. If your child is older than 11 or 12, we may use oxygen therapy. Oxygen is fuel for your child's brain and nervous system. We may use exercise with oxygen therapy. This is ordered by RMD. Again, it's depending on the age of your child. The diet, like I told you, you need to eliminate junk because it's filled with additives, benzoates, flavorings, dyes. We may do cerebellum rehabilitation. The back part of the brain controls balance and coordinated movement. So we may have them on a balance beam. We may use a metronome on a balance beam. We may have them standing on the right leg and catching a ball. We may use vestibular stimulation, spinning in a chair. Stimulates the semicircular canals, fires up to brain. Or head positions. We may use visual stimulation. We may use auditory stim, listening to sound in the right ear, fires up to the left brain, and vice versa. We may use olfactory stimulation. Unpleasant smells fires the right brain. Like I said, in a lot of cases, autistic kids, right brain deficit. So they have a soft lesion. A soft lesion is a lower frequency of firing. A hard lesion is a tumor or like a stroke. That's what I mean by lesion, soft lesion, hard lesion. We may use gross motor postural exercises, cross crawl, neck raises, chest raises. We are going to use something called the Taylor Visograph. Taylor Visograph, you can find out more information at readingplus.com. It's going to measure your child's ability and track the eye movement in their reading. Their ability to read, and it tracks the eye movement. Excellent tool. Read up about it. readingplus.com. We're going to use an interactive metronome. Read up on it. interactivemetronome.com. Okay? interactivemetronome.com. Interactive metronome is visual, auditory, and motor stimulation. Your child has a headset on. They're clapping with the trigger to the sound.